other NGOs or private sector. Pero para sa kanila, para maging self-sufficient sila and hindi nila kakailanganin yung another medical mission or another donations. Okay.
Kung makikita nyo, no, na kung maano yung maraming communities, hindi talaga money ang problema. So, hindi nga talaga budget ang problema, hindi kakulangan sa gamot ang problema. Mainly, ang problema talaga is the attitude ng tao. Attitude, yung character, yun talaga yung problema. So, hindi lang ng mga tao, pati ng mga leaders at ng mga doctors. So, ang tanong ay, ano yung pwedeng magawa? Ano? So sabi nga ni Al, invest it in something that is sustainable. And something that will teach the people. So, something that will educate them. So, kung gusto ninyo, i-enroll nyo lahat sila ng PhilHealth. At yung facility kasi, hindi naman talaga facility din yung kailangan. Si Allan nga, sa Mango Tree lang eh. So, hindi talaga yung facility eh. Pero yung facility, naging result na lang nung pagkakaroon ng health insurance dahil nagkaroon ng income. So, mahalaga din na may facility na may nakikita at merong na-establish doon. Pero mas maganda sanang i-establish ay yung mga tao kesa yung facility. So, yun lang. So,
thank you very much. Any more additional? Lea, Dr. Lea.
Good afternoon po. So I just want to go back dun sa question niya na, why go back to the grassroots? Diba? Kasi, according to our orientation, but we were already in the area before this was told to us. 70% of the population are in the rural communities. 30% nasa urban. Pero ang doctors, 70% nasa urban, yung 30% nasa rural. So mismatch siya. So why we are there? Because we are more in the preventive than the curative aspect of health. So we take care of these people because so many people there die before without seeing a doctor. So we go to their houses, we go to where they are. And then simple things that we do there. If you are high-tech here in Manila, there we just teach people how to wash their hands properly. We just teach them how to build proper sanitary toilets. As simple things as that. And we also even teach them how to give bath to their children. But in that case, if we do that, we diminish the number of people, children, or families who got to the hospital. So we save a lot of resources, especially on money, because these people, they don't have that. Thank you.
Okay. No more comments. Let me just bring to a close what we heard this afternoon. We heard two stories of doctors who traveled the unknown, the cliche that roads less traveled by, these two doctors took, as well as some other doctors who went with them. They took the journey of the Leaders for Health, and they believed that, as they said, one of the learnings that they got from this program, from the Leaders for Health program, is it's important first to know yourself, to have a mastery of self, to have a mastery of competencies, to be able to apply this to a particular particular situation, to be able to bring change to this particular situation that they find themselves in, to involve other people, other stakeholders in the community, because they realize that they cannot change health indices alone. They have to involve the community. They have to involve everyone. Of course, how to do that is the challenge. So these doctors were there in the areas for 4 years for the Leaders for Health program, and this is what we want as a call to you to bring home, no, or to ponder on. How can we support, or how can we ensure that programs that will sustain communities, that will really bring change to communities are supported in whatever way? How can we spread this strategy like wildfire? How can we replicate these doctors to other communities? So far, the Leaders for Health program graduated 2 batches, 11 from batch 1 and 26, around 26 in batch 2. No? They finished their Masters in Community Health Management degree last August. And right now, as Pretchell said, she goes back to Dinagat every month. Allan continues with his public work and public service. But we need doctors like this. We need doctors who will spread like wildfire the challenge of building communities. So we hope that this afternoon you will be challenged enough to take on this journey and to help build communities, no? And to make them sustainable as well. No? So thank you very much for coming. May I reiterate that the Leaders for Health booth is downstairs if you want information, if you want to talk more to the other doctors that are products of the Leaders for Health program, they're downstairs. So please feel free to visit the booth, and please proceed to the plenary in a while for the closing ceremony. Meanwhile, let's have a class picture first before we leave. So they just